So the body gets congested with all the lymphatic fluid inside of the lymph vessels because it cannot propulse it fast enough. So what happens is that the lymphatic fluid leaks out from the inside of the lymph vessel into the interstitial space, which is outside of the lymphatic vessel. And now it's sitting in between. Now, if it's happening in the legs, it cannot go into the bone. It cannot go into the blood vessel. It cannot go into the tendon. It cannot go into the muscle. It really cannot go into the skin until the later stages. So where does it go? It goes into the subcutaneous fat. And the subcutaneous fat is divided into two compartments. So if this is the skin and this is a muscle, you have two compartments of fat. One is superficial, one is deep. The superficial is much smaller. The deeper one is usually bigger. And in my experience, majority of lymphedema actually happens in a deep compartment of the fat. So the lymphatic fluid that leaks out, originally we thought it was protein, but we realized it was not. It's complex hydrocarbons. So what does this mean? Well, complex hydrocarbons are the same substances similar to hyaluronic acid. Remember those injections that women and men get into the lips, into the wrinkles, right? The same principle, the same type of molecule gets out. Complex hydrocarbons, they're strongly hydrophilic. What that means is that they absorb water. So you have a small molecule like this, it gets exposed to water in the interstitial space, and they just kind of increases in size and makes the whole thing very jiggly. All right. The body comes in and says, listen, this is not supposed to be here. Let's clean it up. And the body has really only one way of bringing all this cleaning crew, so to speak, together. And this is inflammation. So it starts sending all these inflammatory factors and it brings all the inflammatory cells, red blood cells, white blood cells, macrophages, T cells, whatever, all those cells. And then they try to chew it up and take it out. The problem is they can't. There's so much leakage going on that it cannot. And you have all this chronic inflammation sitting there in a subcutaneous space for many, many years, if not decades. It's not the inflammation like you have from other medical conditions, but it's still there. And as the inflammation continues, it affects all the tissues around. It affects the nerves because it starts dissolving the coating of the nerve. And now the nerves, instead of passing a 2-point discrimination or feeling of movement, they start passing pain. All right. Then as the amount of fluid increases and it migrates in the fat cells become bigger. They need more blood supply. So the body starts building more blood vessels. But the blood vessels are built in this inflammatory environment. So they're brittle. You push, they break, you have a bruise. Here's how it happens. So as a result of chronic inflammation, now you start having scar tissue forming in the area. So the scar tissue from inflammation, that's what stiffens up the tissues, but it doesn't happen in the beginning of the disease. It happens in the later stages. And as this inflammatory related connective tissue starts choking off the supply of the lymphatics, now you're progressing to lymphedema from lipedema. All right. So I like his explanation of other things, but I think on lipedema, unfortunately, I completely disagree with him. So I think the scar tissue or the formation of collagen tissue is not what's choking the blood supply. It's not what's causing the symptoms, and it definitely was not causing the nerve compression. Hypothetically, it can, but it can only at the later stages when the amount of scar tissue is so much that it starts pinching off the major nerves as they pass through the junction between the muscles. And it usually happens on the outside, on the front, on the inside of the thigh, and outside of the hip. That's where all the major nerves come out through the muscle fibers or in between the muscles and go distally. All right.